excuse me. So the session is arranged by Impact Network, which is a formal collaborative platform for public, private, and donor sector organizations to stimulate, support, and scale social innovative solutions to the development challenges. So before we get started, I wanted to run a quick reminder on how the flow of our session will go today. So there will be a brief intro of the topic, followed by introduction of the panelists, and I'll then kick off the conversation by asking questions from panelists. And at the end, questions from participants will be addressed. And so feel free to submit your question through Q&A window throughout the event. So you can address the question to either specific panelist or the whole panel. So please feel free to submit questions as we are going through the panel discussion. Just a reminder that panel discussion will be recorded and it will be provided on our social media platform later on. So let me take this opportunity now to share why we needed to organize this panel session, why it was so important for us to emphasize on the cross collaboration, particularly in the area of healthcare. So as we've seen that over the past couple of years, the response to COVID-19 pandemic has spearheaded radical transformation in healthcare delivery systems, and that too at exceptional pace around the world. So in Pakistan, one of the major service shifts in the sector had been widespread adaptation of digital technologies to extend quality healthcare to masses, particularly the marginalized community. And it has been seen that numerous public-private stakeholders form partnership with healthcare startups to solve public healthcare challenges which COVID posed to our country. For example, I can talk about InstaCare, which is a virtual healthcare delivery platform, and it partnered with USAID to launch InstaCare Corona Response Unit. Similarly, Sehat Kahani, a very well-known startup in Pakistan, collaborated and worked closely with Ministry of National Health Services Regulation and Coordination, as well as World Health Organization and UNDP to provide consultation to patients during lockdown and beyond. And as a result of these cross-sector collaborations, it was actually due to these cross-sector collaboration that Pakistan was unable to handle this crisis of COVID-19 with relatively fewer ramifications. So it leaves us with no doubt that cross-sector collaboration is critical and need of the time to bring together knowledge, resources, evidence, and creativity to address the challenges and opportunities faced by Pakistani healthcare system. However, whenever we talk about collaboration, it is such a complex topic, and we are all still learning about working together to construct a cohesive response to public healthcare challenges. So our panel discussion today will focus on the importance of cross-sector collaboration, particularly for addressing the country's public healthcare challenges. We'll also see the scope and opportunities presented by such cross-sector collaboration, as well as obstacle and lesson learned throughout the journey of our panelists during COVID regarding these collaboration. In particular, we are very much interested to explore how the government can benefit from partnering with healthcare startups and the best working models for such kind of partnerships. Now, please let me take this opportunity to introduce our amazing panelists. So we have Saflain Haider with us. Welcome, Saflain. Saflain is currently heads Health and Public Sector Division of Rayn Group as a managing director. And early on, he had led a health informatic wing for Ministry of National Health Services Regulation and Coordination as member IT, and represented it at National Command and Operations Center and played a pivotal role in defining tech strategy and providing support to federal and provincial government. So welcome, Saflain, once again. We also have with us Dr. Amir, who is serving as an assistant resident representative at UNDP Pakistan, where he heads the Crisis Prevention and Recovery Unit, which works to achieve United Nations goal of maintaining worldwide peace and security, and also solving economic, social, and cultural problems. We will be joined by Dr. Shahzad, who is the Vice Chancellor of Health Services Academy. So inshallah, when he joins, I'll introduce him to all the participants and panelists. We have with us Dr. Sara Saeed, who is co-founder and chief executive officer of Sehat Kahani. And she's heading all-female health provider network, working to create quality, cost-effective, and ICT-enabled healthcare solution for communities where healthcare accessible, quality, and affordability is still a dream. So welcome, Dr. Sara. Amna Salman has also joined us. She is our partnership lead at one of Pakistan's largest digital health platform, Marham. And she's currently leading partnership with many multinational companies and local companies in Pakistan as well as abroad. Let me just talk about Marham a bit. Marham is basically Pakistan's most trusted platform to find, book, and consult doctors. So once again, thank you for joining us. And now I will move towards question and answer sessions. So my first question is from Saflain. That what was the process of forming partnerships with donors and healthcare startup during pandemic? Usually we don't see the quick partnership forming with government and startups. So how did you expedite that process and what was the impact? Over to Saflain.
Okay. Thank you for the wonderful introduction. Thank you very much for giving us the opportunity today as well. So that's been so nice of you basically organizing a session on such an important topic. So talking about partnerships and
then can you, sorry to interrupt you, can you speak a little louder?
Yeah. Let me just try and do that now. Is it any better now?
Yes, a little, yeah, a bit louder.
Okay. So let me just try and do that now. So essentially, the story of basically establishing partnership with the private sector goes long time back. In my experience of basically working with the government sector, initially with the Punjab government and then obviously with the federal government. If any time this country, in fact, has been hit by any of the pandemics, and I'm specifically talking about the pandemic situations. Let me just give an example of 2011. Back in 2011, Punjab was basically struck by dengue. And unfortunately, nobody in the entire country had a clue that how to basically cure this disease and what are the symptoms, what are we supposed to do, what are the do's and what are nots. So essentially, back in those days, the task which we had at our hands was obviously this, that we need to somehow set up some sort of a mechanism where people at large could basically get their hands onto the information, right? So what we basically did, that overnight we had to basically set up a call center. In order to do this, we basically approached one of the private sector entities, and we asked them to basically come out and help us. Initially, this entire discussion was basically on the voluntarily basis, and I'm really grateful to that specific entity, and obviously the name of the entity happens to be the IBEX Group. So, I mean, all I'm basically trying to say, whenever you basically hit any of the pandemics, the private sector entities are pretty much out there to extend their support. And that is the real power which government sector has. Now, let me just move over to the pandemic situation which we had in COVID-19. But before I move on, let me ask everybody, am I audible? Can everybody hear me loud and clear? All right. So, I mean, let's just moving on to the pandemic situation in COVID-19. Again, we ran into an issue where where the problems were basically that we did not have any data whatsoever. We did not know what to do. Obviously, the tracking mechanism of all of those suspected patients was basically missing as well. Establishing linkages with the labs was also not there. So, I mean, what we did, we approached the private sector entities again and asked them to basically help us out. Let me just give you one of the very, very simple examples. And the example was basically this, that we decided that, okay, mass awareness happens to be the most important component. And in the world of in the world of technology, how could we possibly make this happen? So we came up with this idea of basically coming up with the WhatsApp bot. So that is something we approached again the private sector entities. We requested them. They came out and started helping us out. Then let me just give you another very important example. Then more importantly, obviously, as we all were homebound because of obvious reasons, so all those patients or suspected patients who were basically curious about their health and they wanted to somehow figure out that what exactly is going on. Am I having a flu attack, or is it something which is really, really serious? So we went ahead and basically started requesting telemedicine entities out there. All of those ventures who, in fact, had been working in this domain of telemedicine. Sehat, Kahani, Dr. Sara, Saeed, who is sitting over here, happens to be one of those partners who were basically kind enough to extend all of our support. And based on that support, we in fact launched a full-fledged mechanism from the platform of the government of Pakistan, which in fact was available, which in fact was available throughout the country. And the free of cost consultations were basically provided to individuals out there. So I do have some numbers as well. In the first 3 to 4 months, the telemedicine consultations were basically estimated in excess of 5 million. So that was basically the number which we were able to compile back in those days. Then moving forward, specifically talking about again the COVID-19 pandemic situation. Obviously, government entities had a very limited capability, at least in the beginning, to analyze the data which in fact was coming across. So we went ahead and started basically contacting few of the private sector entities as well. Again, Red Buffer happens to be one of those companies. The other one was basically Love for Data, LFD we call it. So, I mean, both of these companies were kind enough to extend their support, again, initially on the voluntarily basis, to analyze all of that data for us and somehow put together the predictive models on top of that as well. So that is another area which was extremely helpful for us. Now, moving forward, the most important thing which we need to kind of like focus on, that I think with giving you all of those examples, there is a proven case study that whenever there is a pandemic situation, private sector in fact has basically lived up to the expectation. They have extended all the possible support. But at the end of the day, we also have to basically see that how whether government is kind of like really, really serious to take these initiatives to the next step, right? And somehow transform all of those initiatives into something which is really sustainable for the private sector entities, and at the same time which has the potential of basically keep on providing all the fruits to the masses out. So I'm glad to basically share that all of those examples which I have given to you, in fact, transformed into some sort of an arrangement which was long term, right? And then moving forward, in fact, these arrangements, in fact, kind of like played a very important role in devising the policy for the government sector as well. There is this telemedicine draft policy, which was basically shared from the platform of government of Pakistan, from the Ministry of Health. So I mean, all of those things are basically working out and have worked out in the future. But again, more importantly, one last thing, and I think after that, I would rather end my comment over here. The, I mean, talking about the president of Pakistan, right? Uh, the hype was such, right, that the president of Pakistan, in fact, constituted a committee, and he, in fact, looked into the telemedicine uh, uh, technology-related areas himself. And there was a lot of effort, there was a lot of attention which was basically given to this. Coming up with that telemedicine policy happens to be one of the fruits of all of that initiative as well. So, I mean, the the private sector has always extended the support. With the passage of time, I can say this gladly that the governments, in fact, have shown interest and have basically figured out a way, largely to somehow make sure that all of those arrangements are sustainable and have an impact on the long term policy as well. So that is the comment from my side.
Thank you, Saflan. Saflan, and it's really great to see the kind of impact that can be created when government and healthcare startup work together. So it's amazing to know. Thank you so much for sharing your insights and being openly talking about the need for data of the government, and openly saying that government needed the support of private sector during COVID. So my next question is to Amir Saab, that what role did UNDP play in projects like Tele ICU? That is one of the projects which is key highlights when I was doing research on UNDP. And how did you facilitate collaboration between government and healthcare startups? Over to you, Amir Saab.
Thank you very much, Shamila. I'll just briefly talk about the UNDP's role. UNDP actually acted as a bridge between the government In this case, it was the Ministry of Health and health startups like Sehat Kahani to introduce innovative solutions to the national COVID response. UNDP was, when UNDP was approached by the Ministry of Health to support the COVID response, in addition to the traditional technical support, we suggested reaching out to some startups to partner with them. As we had a pre-existing partnership with Sehat Kahani, we thought it would be good to bring them into the loop and see what opportunities there are to work together in this new space at that time, that is just after COVID. One of the challenges presented by the ministry was how to support rural semi-urban hospitals and clinics which were receiving and treating COVID patients, but did not have any in-house expertise from qualified or specialized doctors. So based on this challenge and existing digital infrastructure from Sehat Kahani, we were able to work together to develop a model that actually worked and delivered. During the COVID pandemic, UNDP partnered with Sehat Kahani and trained about 5,000 medical professionals in intensive care, a field of medicine which is specialized and a skill that was much needed at that time, as we know that there are not many specialized intensive care specialists. UNDP and Sehat Kahani have also collaborated with the Ministry of Health in upgrading 60 ICUs in Pakistan's public and private sector hospitals to tele-ICU using the app. This was helped the ICU staff to connect to the teams of skilled critical care nurses and doctors to monitor thousands of patients at hundreds of hospitals virtually. So I think the biggest, I think, result achieved was this shift to the virtual, especially when there was a pandemic and it was very difficult to first it was resource intensive if it was a physical interaction, and then, it wasn't possible. So I would stop here as a response to your question, Shamila. Thank you, and over back to you.
Thank you. Thank you for sharing such an interesting insight into how UNDP played a key role during COVID, especially through the tele-ICU project. And it also really highlights the way UNDP and Sehat Kahani and Ministry can work together in order to create the kind of impact, the first of its kind, basically, especially with, as you were talking about, rural and semi-urban areas. Thank you. My next question is to Marham. I wanted to ask Amna, did Marham enter any partnership to specifically address the healthcare challenges during pandemic? And if so, how was your experience and what was the impact? For example, I was reading that Marham collaborated with the GNN news channel to offer free consultation to public regarding COVID-19. How did that collaboration come about?
Thank you, Shamila, for asking this wonderful question. So when the COVID came, Marham ने जो है वो एक telemedicine हेल्पलाइन लॉन्च की थी पाकिस्तान के सब यूजर्स के लिए, जो कि हमारे अपने प्लेटफॉर्म के थ्रू हो रही थी, और इट गॉट अ ट्रेमेंडस रिस्पांस, जिसके थ्रू जो है वो हमारे बहुत सारे स्पेशलिस्ट डॉक्टर्स या जनरल प्रैक्टिशनर्स जो थे, उन्होंने इन्वॉल्व होते हुए मिलियंस ऑफ कंसल्टेशंस अब तक वो चल रही हैं, वो दे रहे हैं. सो ये एक बहुत ही बड़ा मतलब अपने लेवल के ऊपर एक ब्रेक थ्रू एक्सपीरियंस था हमारे लिए भी, बिकॉज वी वर नॉट एक्सपेक्टिंग कि टेलीमेडिसिन जो है वो इस तरीके से बूम पकड़ेगी और लोगों को जो है वो इतना ज़्यादा इसकी ज़रूरत होगी. सो अपने लेवल के ऊपर बात करने के साथ साथ इफ यू टॉक अबाउट द पार्टनरशिप्स, तो मरहम ने जो है वो बहुत सारी प्राइवेट सेक्टर के ऊपर पार्टनरशिप्स की थी, जैसे कि लोअर टियर के जैसे लोग होते हैं, जैसे फॉर एग्जांपल करीम है, उबर है, फूड पांडा है, इनके राइडर्स वगैरह हैं, या जो इस तरह के लोग हैं जैसे शॉपकीपर्स हैं, वो लोगों को कंसल्टेशंस लेना वगैरह मुश्किल हो रहा होता है, तो हमने उन सबको जो है वो फ्री कंसल्टेशंस प्रोवाइड की थी इस तरह की कंपनीज के साथ कोलैबोरेट करके. फिर we collaborated with banks ताकि हम जो है वो यहाँ पे subsidized करके consultations, tele consultations को provide कर सकें. हमने hospitals के साथ collaborate किया, where we onboarded different doctors और उनको जो है वो telemedicine for non-affording patients उन तक provide करने की कोशिश की गई. GNN या इस तरह के एक और 2 private sector के platforms थे जहाँ पे हमने कोशिश की कि जितना मैक्सिमम लेवल के ऊपर जो है वो टेली कंसल्टेशन के थ्रू सर्व किया जा सकता है उसको सर्व किया जाए. सो इट वाज लाइक बड़ा मिक्स्ड एक्सपीरियंस था बिकॉज टाइम्स भी इस तरह के थे डिफिकल्ट से और आपको जो है वो बहुत रश करके काम करना पड़ा था. बट द गुड थिंग वाज कि मरहम का टेलीमेडिसिन प्लेटफॉर्म इट वाज इतना एस्टैब्लिश्ड कि हम लोग जो है वो बहुत अच्छे से इस तरह के नेटवर्क्स के साथ कोलैबोरेट कर रहे थे. वन मोर थिंग वी डिड वाज के फार्मास्यूटिकल कंपनीज के साथ हमने कोलैबोरेट कर क्योंकि डॉक्टर्स के क्लिनिक्स बंद हो गए थे. वो हॉस्पिटल्स में नहीं जा पा रहे थे बिकॉज ऑफ द लॉकडाउन. सो वी प्रोवाइडेड और सॉफ्टवेयर ताकि कंसल्टेशंस जो हैं वो चलती रहें और मरहम के थ्रू जो है मरहम के सॉफ्टवेयर के थ्रू जो है बहुत सारे डॉक्टर्स वर इनेबल्ड के वो जो है अपनी कंसल्टेशंस जो है या अपनी प्रैक्टिस जो है वो उसको कंटिन्यू रख सकें. So it was a wonderful experience in terms of like providing the help to the patients who were in need. But jo hai alhamdulillah it got really well.
Thank you so much, Amna, for sharing how Marham has played a key role. And also it's really interesting that you have actually went to pharmaceutical companies as well. That is one of the niche which actually could have explored further as well. And I'm glad that it has been explored already. Thank you so much, Amna.
Thank you.
Shamila, you're on mute.
Apologies. My apologies. So Sara, how was the overall experience of Sehat Kahani's collaboration with government and the donors during pandemic? What worked really well with the perspective of healthcare startup? And what were some of the challenges? And did you ever face any conflict with multi-sector partnership? If yes, how did you tackle it? Over to you, Sara.
Thank you, Shamila. First of all, thank you for giving the opportunity and talking about, as the friend said, a much needed topic. And also, I'm so glad that you've been able to gather really relevant people for your topic with the right representatives from UNDP, Saflain and Dr. Shahzad as well, who are one of my mentors as well. So thank you for doing that. And of course, Marham, who also represents the private sector. So kudos on the effort. So Sehat Kahani has been there since the last 5 years. We established in 2017, and we started creating clinics in low-income communities that enabled telemedicine between low-income community patients and online doctors through nurses or nurse intermediaries. But in 2019, we launched our app as well for the commercial market so that any smartphone user can connect to a doctor. And the biggest USP that Sehat Kahani had and still has today, that was a learning from our clinics, that when a patient comes to a doctor in a community clinic or in a private care setting, they do not want to wait. They want to be seen urgently. So we created a provision for a consultation within 60 seconds with an online available doctor. Because we had the platform available and because there were people like Saflain who were there at the beginning of pandemic looking for private partners, to solve a big challenge for the government then was when the country was going into lockdown, how do you provide healthcare to patients at home? Because Pakistan is already a country that has a lot of healthcare issues. So COVID was not just the concern at that moment. COVID was when OPDs locked down, when hospitals locked down, how are people going to reach out to physical or mental health doctors for their issues for COVID as well as other than COVID as well. So I think it was a huge initiative of the ministry and Digital Pakistan, that was the entity at that time, in March 2020, to reach out to private sector and ask for them help, which for me was a very refreshing change. So we started working together with Digital Pakistan, with the NCOC and federal government, and Saflain was a huge part of initiating that partnership. And what we did was we made our app free for a period of 6 months so that any patient who comes online can get consultation for COVID as well as for other problems that a patient has. And that particular initiative is very close to my heart because it was able to help so many patients. I'll just quote 2 examples. You know, we helped a woman in labor at 4 a.m. in the morning in Gulistan-e Johar, Karachi, reach to a tertiary care hospital and her husband was stuck in Dubai in the middle of COVID. And this is May 2020 I'm talking about. And then there was another patient, elderly patient in Quetta going through heart failure and could not manage his symptoms because he couldn't connect to his cardiologist. So these two examples tell you that how patients were helped because of a collaboration between a private partner and the government. And we created a test tracking system. So we were able to report back all the COVID-19 patients coming on Sehat Kahani app to the government to make sure that it helped them in smart lockdowns, in their data analysis, which they were already doing a great job. But I think after that, after this initiative, Sehat Kahani got 3 amazing opportunities to work with the government and with the donor sector. One of the projects that Amir also talked about, the tele-ICU project, is extremely close to my heart because it was a new domain for Sehat Kahani. And the need came that critical care is extremely less in Pakistan. There are only 70 critical care specialists. So the government wanted that the DHQs, the district healthcare units, the tertiary care hospitals, where tertiary care staff is not trained for ICU care, how can we make sure that an app is available with them at all times that can help them connect to any critical care specialist online and help a staff or a GP doctor in emergencies to make sure that a critical patient is helped, particularly COVID-19 patient. And I think this was a remarkable initiative because it took 4 entities. So there was Sehat Kahani, there was UNDP as the primary donor, there was UNFPA, there was also HSA that provided the training support for critical doctors and provided as doctors as well. And of course, the government who came, both the federal and provincial government. And this was a multi-sectoral project spread across Pakistan in 60 ICUs, including public, private hospitals, ranging from DHQs to tertiary care hospitals. And I must tell you that, DHQs from Batkhela, Batagram, Faisalabad, Multan, all the way to Khairpur, Sindh, and Balochistan as well, where there was no internet. And ultimately, we launched a helpline for tele-ICU, came together and made this project possible. And that was a huge learning for me because A, it showed that ICU care can be provided through telemedicine if the right stakeholders are at play. And B, around 6,000 patients were managed in ICUs using the application. So again, a big win for all the stakeholders, including Sehat Kahani. And then later on, we worked with UNDP to include mental health post-COVID-19 as well, to launch an initiative in 5 universities across KP. Again, government universities, a donor coming together and providing mental health opportunities to students who were undergoing anxiety and trauma post-COVID-19. So I think we've had a fair experience of working with the government in COVID-19. One thing that I've learned that I want to share is these pilots are great chain breakers that, yes, an initiative in innovation and technology can be launched once the stakeholders come together. We talk about a lot of physical meetings now, but I tell you, all these projects were launched through virtual meetings in day-after-day collaboration between stakeholders. Our app was ultimately integrated in the NIH portal called Sehat Express, again, an initiative by Saflain. So that's one of the examples of long-term sustainability of a private sector company being integrated in a national portal. Our mental health application still works in the universities. And the tele-ICU program is still ongoing in some public as well as private hospitals that we partnered with. I think the long-term challenge is how do you sustain these initiatives when we come out of a situation such as COVID-19? There are some initiatives such as Sehat Express that builds long-term sustainability. And I think the thought of Saflain was that how do we create an initiative and build it for the long term? But I think a similar streak needs to happen for other initiatives such as the tele-ICU project, so that as we come out of the pandemic, we will enter into more pandemics, if not COVID-19. So we need to be better prepped this time with such initiatives to handle the load as and when it comes.
Thank you, Sara. What a great way to explain how powerful this the multi-sectoral collaboration is for such a huge impact. And as you were saying that you've actually reached the masses and people were actually, they were open to use digital healthcare applications as well. So that's an amazing achievement. And yes, sustainability, as you mentioned, is a hot topic, that how are the initiatives which are very great and had an impact, how would they be sustaining in long term? This brings me to my next question to Saflain. that the government was able to receive like massive outreach and impact with the help of healthcare startup during pandemic. Um, Although you've explained a little bit earlier, but I just want you to reiterate that what is government's healthcare strategy going forward? And is the government planning to replicate these partnership model for other public healthcare issues such as HIV, polio in the country? Are they? If yes, then what motivates, and if why, then why not? Over to you, Saflain. And you're on mute.
Sorry, my bad. Okay, so I mean, as Dr. Sara has basically elaborated, uh, goes without saying that all of those initiatives have proven to be extremely helpful for the government sector, and more importantly, to basically reach out to masses and provide all the services to the poorest of the poor out there. So essentially, government, in fact, has been thinking very closely of basically building on those partnerships, making them sustainable, and taking them forward. Let me just quote a few of the examples over here. One of the initiatives which we basically did in the back in my days with Punjab government was basically to extend these telemedicine services to all of those BHUs and RHCs where because of whatever reason we were just unable to place a permanent doctor. That happens to be a very practical issue, right? So the solution which we came up with that, okay, let's just combine two neighboring facilities, right, in any of the districts, and place one doctor who essentially will be available at each of those neighboring BHUs or RHCs, right, in an alternate days. On a day when he's not physically present at a certain facility, he would basically be seeing the patients of the other facility remotely using the telemedicine platform. And again, that telemedicine platform was basically extended by the private sector entity, right? And then more importantly, and that's where I want to basically bring the focus of this entire forum, that essentially this entire arrangement was not on the pro bono basis, because essentially I think when we talk about these partnerships and everything, we got to basically give a very we got to give a very detailed thought to the process, that all of those private sector entities who are always there to basically help the government sector, they are not there, I mean, for the sake of being there, right? Well, they are providing us the pro bono services for a specific period of time, but then we have to find out a way that these commercial entities have some medium to basically sustain. So that is extremely important, right? The group I am basically associated with at this point of time, we are specifically being asked by the government of Punjab to basically extend help in the blood transfusion area, right? So just giving you another example, that I mean, all those government agencies are basically giving due importance, right, to the private sector players, and then more importantly to the subject matter experts, that okay, that's where we'll be needing intervention, and we definitely need some sort of an intervention which is sustainable. So I think that is something which is the key. Another very important area, although this is not part of your question, but I am so I think I can't really hold myself back of basically explaining this to you. I think for the government sector, a very important component happens to be that, let's say if there is an initiative, which in fact we have basically taken up for a certain period of time, right? We got to have some sort of a mechanism for the government sector as well, that this entire initiative would go a long way. Because essentially, if a private entity is basically being involved, right, to basically provide services for a limited period of time, maybe in form of a project or whatever, what happens when that private sector entity pulls itself out, the entire initiative falls apart. So, I mean, one of I mean, and let me just say this: the discussion which I was basically having with the Secretary Health back in Punjab was basically this: that okay, we'll be needing your intervention in these areas, but then more importantly, you have to give me the transition plan as well. That what happens once you basically pull yourself out. So I think the importance of the private sector and the realization that how subject matter experts are basically extremely important is pretty much out there. And then more importantly, government sector is also very keen this time around to somehow make sure that all of those limited time initiatives somehow find out a way to stay there for a very longer period of time for the masses out there. So I hope I have answered your question.
Yes, thank you, Saflain. We are also very excited that government is taking initiatives. I mean, they're actually thinking about they have identified the importance of private sector, and now they are thinking about taking these initiatives forward. That's very exciting. Thank you for explaining it so well. So Amir Sab, how was the experience of working with stakeholders from multiple sectors for tele-ICU project? Or what were the challenges of engaging with different partners, and how did you overcome those? Because UNDP was the one who was working with so many different partners, and they brought all different partners to one platform. So really want to know about your experience.
Very quickly, Shamila, if UNDP, just by way of background, has a very long track record of working with the government of Pakistan. So I would say that in a lot of areas in which we work, we are in a way, advisors or the principal advisors to the government on, the things we are doing. And definitely pre-COVID, health was not one of those areas. However, UNDP had a background of working on health systems management across the world, and also handling large global fund grants for HIV and others. So we did have that global expertise plus the national partnership, or you can say the capital, to work with the government. What UNDP normally does is it plays an integrator, because since it's the development program of the United Nations, it plays an integrator role within the UN systems and is used to working closely with the stakeholders from government, civil society, and private sector to achieve collective results. So we had this overarching role of introducing innovation for development and bringing partners and actors together to collectively deliver on the results. Also, I think UNDP works within the framework of Sustainable Development Goals, SDGs, and the collective approach is necessary if we intend to achieve the SDGs. While the provincial and federal health authorities were very supportive of our initiative, it was difficult to convince staff at the hospitals of benefits of using technology. I think this is the story everywhere, not just with the hospitals, but wherever you are introducing technological solutions, there is some resistance to that, and sometimes it's not that incorrect, because many times technology can be exclusive as well. So the Sehat Kahani team, they were amazing, and we were able to explain the benefits and train the staff on how to use this technology, and just to convince them that it is to benefit them. And I think with the help of Sehat Kahani, we were able to bring some behavior change, in or attitude change in those teams who were to use the technology. So this is briefly from my side, Shamila. Over.
Thank you, Amir Saab. Thank you. Collaboration and work of this, this scale, where it has many benefits, it also comes with many challenges. Thank you for explaining your perspective well. So my next question is from Amna, that Marham has been providing telehealthcare services in Pakistan for last 7 years. Yeah. And you have talked about private sector partnerships, but have you ever tried partnering with government or the donor sector to provide healthcare to marginalized community? And if so, what were the challenges you faced, your particular challenges? Over to you.
First of all, I would like to appreciate Dr. Sara. Sehat Kahani has done an amazing job. मैं अभी सब सुन रही थी और I know about मैं सुनती भी रहती हूँ पहले, बट बहुत अच्छा काम किया है आप लोगों ने. अच्छा, जहाँ तक गवर्नमेंट सेक्टर की बात है, we tried obviously सबसे पहले जो हमने 3 to 4 years back we tried कि हम जो है EMR systems गवर्नमेंट हॉस्पिटल को प्रोवाइड कर सकें, बिकॉज मरहम ने जो है वो एक उस एरिया को भी टच किया था जिसमें हमने एक सेंट्रलाइज्ड EMR सिस्टम बनाया था ताकि हम पाकिस्तान से जो पर्ची सिस्टम को रिमूव करके उसको डिजिटलाइज कर सकें। बट वहाँ पे हमें काफ़ी रेजिस्टेंस फेस करनी पड़ी थी, डॉक्टर्स भी एग्री होते थे और जो है हॉस्पिटल्स भी समहाउ एग्री होते थे, लेकिन उसके अप्रूवल्स में और उस तरह की चीज़ों में हमें प्रॉब्लम आ रहा होता था। देन द कोविड केम और उसमें गवर्नमेंट को अप्रोच करने की कोशिश की गई थी, बट बहुत ज़्यादा लॉन्ग प्रोसेसेस इन्वॉल्व थे और मरहम का जो ज़्यादा फोकस था वो ये था बिकॉज वी हैव गॉट अ ह्यूज पेशेंट बेस जिसकी बहुत ज़्यादा रिक्वेस्ट आपके पास जनरेट हो रही होती है फॉर ऑनलाइन कंसल्टेशंस। इफ आई टॉक अबाउट द नंबर्स तो हमारी मोर देन 20,000 ऑनलाइन कंसल्टेशंस पर मंथ हो रही होती थी। सो ऑलरेडी उनको केटर करना, फिर जो प्राइवेट सेक्टर की पार्टनरशिप्स हमने की थी उनको केटर करना, उसमें जो है वो हम फोकस बहुत ज़्यादा था। और गवर्नमेंट में क्योंकि लॉन्ग प्रोसेसेस इन्वॉल्व थे और ऑलरेडी एक बहुत अच्छा सिस्टम जो है वो शुरू हो चुका था, सो उस तरीके से हम नहीं कर सके। बट ये है कि वी आर कम्प्लीटली ओपन फॉर इट। एक जो चैलेंज जिसके बारे में मैं बात करना चाहूंगी वो यही था कि टू रीच टू दी गवर्नमेंट ऑफिशियल्स और उन तक जो है वो लाइक थोड़ा सा जो प्रोसेस, डॉक्टर सारा को भी ये चीज बहुत अच्छे से वो इसको सेकंड कर सकेंगे कि जो इम्प्लीमेंटेशन वाला प्रोसेस होता है उसमें जो लॉन्ग टाइम अगर इन्वॉल्व हो रहा हो तो वो काफी प्रॉब्लमैटिक हो जाता है फॉर अ सिस्टम अगर आप उसको ऑलरेडी रनिंग कर रहे हैं इन टर्म्स ऑफ रिसोर्सेज एंड एवरीथिंग। सो ये एक चैलेंज हमें फेस करना पड़ा था, बट लाइक दैट्स द ब्लेंड ऑफ प्राइवेट एंड गवर्नमेंट सेक्टर। उस तरीके से ऑब्वियसली आप अपना ये हेल्थ साइड को कवर कर सकते हैं, सो वी डिड प्रीटी वेल इन दैट।
Thank you, Amna. And yes, the challenge that you have mentioned is one of the key challenges, that how to approach government. And that is one of the key reasons that we have this.
अप्रोच करने के बाद जो टाइम लॉन्ग प्रोसेसेस इन्वॉल्व होते हैं और उसमें भी ऑब्वियसली फिर इट टेक्स टाइम।
Thank you. My question is from Dr. Sara. As Amir sir was mentioning that sometimes there is a lot of resistance from people in terms of tele healthcare services. So in partnership with Health Service Academy, you trained a lot of doctors in tele ICU project, like you were the provider of telemedicine, but obviously doctors were using it. So have you seen any barriers to technology adoption by healthcare providers or the patient? And if so, how did you address them? Over to you, Sara.
Thank you, Shamila. So yes, I think we have worked with, I just want to start by mentioning it that we have a network of 7,000 doctors, and we have worked with UNDP mostly to train our doctors from time to time, and they have been very helpful in the youth empowerment initiative. So particularly in COVID-19, we got to train 5,000 doctors for critical care services. Again, I just want to highlight this fact कि पाकिस्तान में सिर्फ 70 क्रिटिकल केयर स्पेशलिस्ट हैं। इनफैक्ट जब हमने बलूचिस्तान में लॉन्च किया था प्रोजेक्ट, तो वहाँ के एक सीनियर डॉक्टर ने मुझे बताया कि बलूचिस्तान में उस टाइम पे सिर्फ एक क्रिटिकल केयर स्पेशलिस्ट था विद ऑथेंटिक डिग्रीज टू हैंडल क्रिटिकल केयर एंड इमरजेंसी मेडिसिन। सो यू कैन अंडरस्टैंड द डर्थ ऑफ द इश्यूज. So we trained 5,000 doctors, and this training was not only done for Sehat Kahani doctors, it was done for all the HSA doctors जिनको वो already train कर रहे थे. And I think Dr. Shahzad and his team was a remarkable help. हमने कोई 20 batches में उनके doctors को train किया. फिर PNS शिफा के doctors हमारे साथ as consultants शामिल थे, तो उन्होंने एक बहुत बड़ा role play किया in leading the tele ICU project. And some of those doctors are still working on Sehat Kahani platform as critical care specialists. जहाँ तक barriers की बात है, I think COVID से पहले हम सुनते थे, and because I've been working in telemedicine for the last 5 years, कि जब तक डॉक्टर पेशेंट की नब्ज नहीं पकड़ता या उनका एक फिजिकल इंटरेक्शन नहीं होता तो पेशेंट सेटिस्फाई नहीं होता. आई थिंक कोविड ने इस नैरेटिव को बहुत चेंज किया है, बिकॉज कोविड वो पहला टाइम था व्हेन पीपल रियलाइज दैट फिजिकल डॉक्टर्स आर रिस्की एंड वर्चुअल डॉक्टर्स आर सेफ. And I think over time, because of these partnerships, because of the small little role that startups like Sehat Kahani and Marham got to play in COVID-19, and I say small because there's still a 220 million population. None of us is covering that population to a bigger level. We are still all trying to establish ourselves in the telemedicine sector. So I think what trust developed hona shuru hua between doctors and patients. Doctors took this up as an opportunity. Because उनका physical OPD या physical hospitals में जो caregiving process था वो hamper हुआ. So doctors started taking up this opportunity. Patients became more comfortable. So उसका एक सिंपल सा सबूत ये है कि सेहत कहानी पे लास्ट मंथ हमने 1,40,000 consultations किए, which is our highest consultations ever, which is post COVID-19, post pandemic, all the hospitals are open. But still जो हमने एक momentum create किया था in COVID-19, working with the private sector, working with the public sector, working with corporates, I think that momentum is now spilling over and people are having more trust, because in a country like Pakistan, जहाँ पर आपके पास आधा डॉक्टर है on 1,000 patients, जहाँ पे लोगों को हॉस्पिटल जाने के लिए ना सिर्फ फ्यूल चाहिए होता है, वो अपने खाने पीने का बंदोबस्त करते हैं, बहुत सारे लोग अपनी डेली वेजेस को छोड़ते हैं, और बहुत सारे लोगों के लिए एक्सेसिबिलिटी नहीं होती है who live in the rural areas to go to a doctor. मुझे याद है मैं केपी के गांव में गई थी क्लिनिक ढूंढने के लिए 2017 में, और मैंने देखा सुबह की एक बस भर के औरतों की जा रही थी टर्शी केयर हॉस्पिटल एबटाबाद, और वो गांव वहां से 3 घंटे दूर था, और वो बस भर की शाम में वापस आती थी। तो ये एक्चुअली हमारे मुल्क में होता है, और इसके लिए टेलीमेडिसिन इज अ बिग सोल्यूशन दैट कैन डू दैट। बट आई थिंक जो सबसे इंपॉर्टेंट चीज हुई है, जो सफलैन ने ब्रीफली मेंशन की थी, एंड आई विल जस्ट टेक 2 minutes एंड मेंशन इट। 3 वेरी इंपॉर्टेंट थिंग्स हैपन इन 2021 जिसकी अब इतनी बात नहीं हो रही और होनी चाहिए। एक, जो नेशनल टेलीमेडिसिन पॉलिसी फॉर द फर्स्ट टाइम क्रिएट की federal government, and Saflain was the person who held that. And of course, it could not have happened without the consultation of donors such as UNDP. एक national regulatory framework बना जो डॉक्टर फैसल सुल्तान ने लॉन्च किया, अगेन अ ह्यूज स्टेप टुवर्ड्स डिजिटल हेल्थ केयर, और सिंध ने टेली हेल्थ का बिल पास किया। आई थिंक दीज 3 initiatives will make a work of organizations such as ours, Marham, and all the governments that now follow on so much easier, because now we have a precedent that we can say that yes, it is legal in Pakistan, it is helpful, the government endorses it at some stage. So even if that process is new, I think that was the main barrier, if you ask me, in connecting doctors and patients through telemedicine, because किसी भी दिन आके कोई हमें challenge कर सकता था कि this is illegal, which is not a possibility now. So I think regulation challenges are solved, internet connectivity is increasing day by day, patient का trust बढ़ रहा है, and I'm very hopeful that a lot of Pakistan's healthcare issues at primary healthcare level can be managed through telemedicine and telehealth in the future.
Thank you, Sara. Yeah, it's very interesting to see like how your experience shows the adaptation of technologies by not just by doctors, but by population itself, and especially as you were talking about the marginalized population where doctors are not readily available. Thank you so much. As Saflain has Saflain, my question is to you. You've already like explained about government being very serious about it, but during COVID, we have seen that it's usually the donor sector that acts as a broker between government and startups. So, can government directly purchases services from healthcare startup now, or would it always need a donor to fund such partnerships? Any highlight on the plans? You can like explain briefly because you've already said some of it already. Thank you.
Thank you very much, Shamila. So, I mean, essentially, there are different ways which are basically in operations as we talk about it. The difference which I have basically noticed based on my experience, donors' intervention is probably is fairly visible when you talk about the federal government. Donors, and I'm talking about the donors' interventions is far more visible in the federal sector when as compared to when I basically compared it with the provincial governments. So when you talk about the provincial governments, they largely are dependent upon basically engaging startup entities through a process, which is obviously the PEPRA rules and all that kind of stuff. It needs to be followed and everything. And it's in most of the cases, this is like the government who kind of like arranges for funds and pays money for it. To me, that is far more sustainable approach. If I basically put on the government hat. Then talking about the federal government, in federal government, as there is a lot of intervention and loads and loads of donors who are basically out there, right? So in the federal government, the intervention from the donor community is far more greater, and obviously that is something which goes in our favor. But essentially, at the same time, there is this PPP initiative as well, which has been going on since ages in the government sector. I wouldn't really comment on how productive it is, because in my experience of basically last 15 years or so, I haven't seen much happening out of that specific platform. So maybe that happens to be one area which probably needs to be focused on as we move along. So Shamila, I hope I have answered your question.
Yes, thank you, Saflain, for your input. My question is to Amir Saab, that you have worked, UNDP has, worked with startups and created a lot of impact that we see. But how do you see the future of collaborative healthcare project that we saw during pandemic, like tele-ICU? I really want to know the donor perspective in it. And how can we continue with such project to meet healthcare goals? Over to you, Amir Saab.
Thank you, Shamila. Can you hear me?
Yes, I can.
Okay. Just wanted to make sure. So, during the COVID pandemic, we've learned a lot of lessons, including infection control treatment and discrimination against affected people. I think these COVID lessons are very helpful for the future of prevention and treatment. COVID, as we see, is ending in Pakistan, hopefully, inshallah. But collaborative healthcare projects, they are still going on and getting even more important. For example, as you know, that the global fight against HIV/AIDS has been going on for about 40 years. We've made significant progress, but a lot needs to be done to reduce it to zero. I think basically a lot of the lessons we learned from COVID are very, very relevant for other infectious diseases as well. The Global Fund for HIV/AIDS, tuberculosis, and malaria, they have chosen UNDP as their partner and as the PR, and we are implementing a huge grant, which is about 50 million. It started in July 2021 and will conclude in December 2023. So basically, I think we are looking at a lot of, I think, lessons from the last year. First of all, I think when we started implementing this program, our partnership, which was enhanced with the Ministry of Health, other partners like Health Services Academy, which Dr. Shahzad is leading, our partnership with them, which was already existing and was enhanced, strengthened in COVID, has also, let's say, made us more effective in terms of implementing new health programs. So that's like a very personal or a very organizational viewpoint from UNDP. That is one. Also, I think we have, been involved at the provincial level. So I think COVID was an exercise which was across Pakistan. You saw the NCOC and the others. And I think because of that, my feeling is, and probably Dr. Shahzad can shed more light on that, I think the federal provincial partnerships on health have been strengthened, and I think the joint areas of work are already, there, which we can see. Also, I think, what we are now looking at is the successful implementation of this grant, on HIV/AIDS, which is prevention, treatment, and and then the second part is that UNDP is also working closely with the Ministry of Health to get 36 oxygen plants across 36 hospitals across Pakistan. And this again, I think, is a partnership which came during COVID, but I think will be concluded after COVID. And I think the beneficiaries are going to go much beyond in terms of COVID. Also, I think in the United Nations 2030 Agenda for Sustainable Development, we aim to end the epidemic of AIDS by 2030. We're trying to make sure that every person has access to prevention, treatment, care, and support services, and no one is left behind. So I would say that while this has been, a great story in terms of partnership from, the private sector, the government, and, also the international partners, international organizations like UNDP. But my experience is that it takes a lot to sustain these initiatives beyond a crisis situation. So I think what is needed is to, what it requires is that full involvement of people from all across, all walks of life. The community-based organizations can play a key role. So I think it is therefore also heartening to see the commitment from organizations like Sehat, Kahani, and others, which are here and have been have actually further strengthened their roles as integrators beyond after the pandemic. So I think these are a few points I wanted to share, and I think the other panel members would also have their view on that. So thank you from my side and over.
Thank you, Amir sir. And it's really good to know that UNDP is already thinking about sustaining some of its projects or programs, I would say, that were initiated during COVID, but they are already planning for their sustainability. That's a very interesting point. I wanted to welcome Dr. Shahzad Ali Khan. He has just joined us. He's the Vice Chancellor of National Health Services Academy. Dr. Shahzad, Assalamu alaikum and welcome on board.
Ji, Assalamu alaikum, and sorry for the delay. I was in Peshawar. I am still in Peshawar. अब Sara हंसेगी कि ये फिर फिरता रहता है. आमिर साहब को भी पता है मेरी आवारगी जो है ना वो मसला बनता है. तो यहाँ सिग्नल्स के थोड़े इश्यूज थे कैंट एरिया में. अभी मैं बाहर आ गया हूँ. Over to you.
Thank you so much, Shahzad Saab. Since I would really like to take the opportunity to ask the same question to you as well, that how do you see the future collaboration of, future of collaborative healthcare project that we saw during pandemic, like tele-ICU, which is like one of the really
Bilkul.
And
yeah, thank you.
Yeah.
Sorry.
No, I just wanted to know how can we continue with such projects to meet our healthcare goals? If you can briefly answer that, I would really appreciate. Thank you.
पहले मैं problem बताऊंगा. There is a problem with the health itself. Remember, the cross-sector collaboration is not refused or not developed, not because the other sectors don't want to collaborate. The problem is the territorial mindset which the health sector has. So if anything is outside healthcare delivery system, the health people are not comfortable. So definitely, I will say in Pakistan, the pathetic condition of health is one of the biggest reasons. That is why I was very much interested in talking today, just to highlight a point that it is not the responsibility of the non-health sector to collaborate with health. It is the responsibility of the health people, health professionals, health system experts to collaborate with the non-health sector. If I tell you that there are around 8 primary healthcare components, we always teach our students and we tell them these are primary healthcare, PHC. Even at the PHC level, what to talk of the tertiary care and advanced diagnostics and other things where non-health sector is very much relevant. Even in the primary healthcare, if you see these 8 components, the first of them is water and sanitation. The number 2 is food and nutrition. And then there is education, health education. Then there is family care, maternal, population planning, family planning. So you keep on adding primary healthcare components and you will find that only 2, which are treatment of common illnesses and provision of essential drugs. These are the 2 which remain with the health sector, healthcare delivery system. So in out of total 8 components, you cannot deliver 6 components without cross-sector collaboration. At a primary healthcare, what can you do at a secondary and tertiary care? So there is a, and I think Amir mentioned we learned in disaster, and we always wait for the disaster to teach us a lesson. We never anything proactive. We always wait for. So polio is dengue taught us, has been my student, and I always say I don't teach anything. It's the disasters of this country which make people public health important. So when dengue was not being controlled, we were not able to control dengue inside hospitals. The public health developed, and now all the cross-sectoral collaboration is there for dengue control, and we have done much better than any other country. But we learned the hard way after having 200 plus deaths in Lahore in 2014 and 2015. And then we learned that, oh, it is not the job of the healthcare delivery system or a health professional. If you talk about heart diseases, if you talk about even the simple case of diarrhea, cholera, gastro in Sindh and all other areas, it is not the job of a medical doctor to control that, because he is there to treat. We are not protecting people. We are not doing anything, and that is outside healthcare, the healthcare delivery system. So coming back to your question is very simple. It is the responsibility of myself to go out and seek collaboration with those people which are very much important to health, and I know much better than any other. And by I mean a health professional. So health professionals को पता है कि हमने क्या किस के साथ collaborate करेंगे तो हमें health बेहतर होगी. हम करना ही नहीं चाहते. So the cross sectoral collaboration का जो onus है, responsibility का जो पूरा burden है, it is on health department, and health department is very afraid of working with the non-health sector. They lack the capacity. They don't know how to communicate. Unfortunately, मेरे पास आते हैं, हम उनको train करते हैं personal communication में, and then they say, यार ये तो बड़ा आसान. After just getting a small briefing session or a training, they start talking to other sectors. Amir साहब ने बात की COVID की. Yes, the COVID was a disaster, and we started talking to all the people in COVID. So our response was very good because there was no system, and suddenly the system came into existence, which was called as NCOC. So NCOC did all that thing. NCOC is one of the best example of cross-sectoral collaboration. मैं अंदर बैठा होता था, आपको हैरानगी की बात बताऊं कि हम वहाँ पे हॉस्पिटल की बात ही नहीं करते थे. We knew how many CCUs we have, how many oxygen beds are there, how many doctors are there, how many people need training. मैंने और सारा ने हमने प्रोजेक्ट्स भी किए हैं UNDP के साथ, काफी सारे डिस्टेंस लर्निंग के, क्रिटिकल केयर के, टेली ICU के. We knew the data of health, but the NCOC, what NCOC did was प्रोड्यूसर के पास जाना, प्रोवाइडर के पास जाना, सप्लायर के पास जाना, उनको बुलाना, and all the tasks of non-health sector and cross-sectoral collaboration were done by the NCOC officials. And they were simple medium-level officials. They were not high-ranking officials of the Department of Health or NADRA or NDMA or anyone else. So आम से आदमी थे, उनको सिर्फ गाइड किया गया, and they did wonders. The same is going on in dengue. Dengue अगर आप देखें तो it is an excellent example of cross-sectoral collaboration. Technology बहुत जरूरी थी. That is why Sara is here. She very good job in during that time as well. Amir साहब को पता है UNDP ने बहुत support किया digital उसमें telemedicine में ADB की support थी. So this is what we did in a very small period of say 1 year. The first year was learning phase 2020. हमने कोविड को समझा और हमने कोविड को देखा. दुनिया को नहीं पता था. No one knew how to respond. Then 2021 was much better. And if you see the subsequent waves, was first wave के बाद second, third, fourth, and even fifth wave तक अगर आप जाते हैं, you see the fatality, complication rate, admission rates go very drastically down. इसका मतलब है कि हमने काम किया. So मेरा जो message है आज का वो ये है कि cross sectoral collaboration has to be initiated by health department. It has to be initiated by the people working in health sector. But I'll share with you my own experience. I have always found the population department or nutrition department or water and sanitation or social protection or whatever, finance, education, very much interested in collaborating with health. It's the people inside the health department who don't want collaborations because of some कहते हैं ना थोड़ा सा उनको एहसास कमतरी है या शायद उनको बात करना नहीं आता. I don't know the reasons, but there are many examples which I can tell you that they do not want to go outside their sector. और इसके बगैर पाकिस्तान में हेल्थ का तो कोई फ्यूचर नहीं है. आपने कहा ना फ्यूचर है ही नहीं अगर आप क्रॉस सेक्टरल कोलैबोरेशन नहीं करेंगे. फ्यूचर डिजिटल हेल्थ का है, फ्यूचर टेक्नोलॉजी का है, फ्यूचर सब कुछ ऑनलाइन चीजों का है, फ्यूचर तो टोटली कम्युनिकेशन का है, कम्युनिकेशन का, पर्सनल कम्युनिकेशन, आप बात कैसे करनी है आपने. तो ये फ्यूचर बनाने के लिए डेफिनेटली यू नीड टू गो आउट ऑफ द हॉस्पिटल्स. ओवर टू यू.
Thank you, Dr. Shahzad. You very well explained that yes, although there is a resistance from healthcare side, but it is basically the people from healthcare field that would have to come up and adopt these new technology and these innovative solutions. Thank you so much for your answer. My next question is to Marham. From Marham, Amna, can you please explain that you know the government issued a telemedicine policy draft last year, as Saflain was also mentioning during his answers. So what are some of your thoughts on that policy, and what changes would you suggest for that policy?
ठीक है, थैंक यू फॉर आस्किंग दिस क्वेश्चन। इस ड्राफ्ट जो है वो ये सीरियसनेस शो कर रहा था गवर्नमेंट की, कि गवर्नमेंट जो है वो इस तरफ आ रही है और इंटरेस्टेड है। जैसे कि और भी बहुत सारे इनिशिएटिव्स मेंशन हुए डिजिटल हेल्थ के लिए जो गवर्नमेंट ले रही है, बट द पॉइंट इज कि जैसे डॉक्टर शहजाद कह रहे थे अभी के सिर्फ इस हद तक नहीं है, ये हेल्थ का जो लैंडस्केप है ये मच ब्रॉडर देन दिस है। अगर हम फॉर एग्जांपल रूरल एरियाज की ही बात कर लें, वहां पर 4-5 गांव तक जो है वो 300-400 किलोमीटर तक कोई प्रॉपर हेल्थ केयर फैसिलिटी अवेलेबल नहीं होती। कोई कंपाउंडर उसको कॉमन जुबान में बोलते हैं, वो तक भी अवेलेबल नहीं होता, बिकॉज आई बिलोंग टू द वेरी बैकवर्ड एरिया ऑफ पंजाब, जिसको हम कह सकते हैं साउथ पंजाब। सो आई नो दिस कि मेरे गांव में कितने लोग जो है वो मरते हैं। सो अगर हम टेली कम्युनिकेशन वाली टेली कंसल्टेशन हम वहाँ पे लेके जाना भी चाहें और गवर्नमेंट की सपोर्ट से भी लेके जाना चाहें, तो वहाँ इंटरनेट नहीं है। वही क्रॉस सेक्टर वाली बात आ जाती है कि वहाँ पे आपको इंटरनेट चाहिए, वहाँ पे एजुकेशन नहीं है लोगों को बताने के लिए कि आपको डॉक्टर के पास जाना है, या आपको जो है वो ऑनलाइन कंसल्टेशन के थ्रू या इस तरीके से अपना इलाज करवा सकते हैं, किसी से एटलीस्ट बात कर सकते हैं। सो एजुकेशन का मसला है। सो इट्स नॉट जस्ट दैट कि आप जो है वो ऊपर से हम लोग इनिशिएटिव्स ले लें और हम कह लें कि बस अब झटपट सब सही हो जाएगा, लोगों का एटीट्यूड बदल रहा है, लोग जो है वो अब ऑनलाइन कंसल्टेशन लेना शुरू हो गए हैं, डॉक्टर्स इस तरफ आ रहे हैं। इट्स नॉट दिस सिंपल ना। इसके अलावा भी जो है वो हमें बहुत रूट एरियाज को आइडेंटिफाई करने की जरूरत है कि कहाँ जो है वो हमें ऐसा, क्योंकि वही डॉक्टर शहजाद वाली बात है कि हेल्थ वाले लोगों को ही आना पड़ेगा। डॉक्टर सारा भी एजुकेशन के ऊपर जो है वो बहुत ज्यादा काम करती हैं इस एरिया में, हम लोग भी करते हैं, ताकि हम लोगों को बता सकें कि आप लोग जो है किस तरीके से अपने आप को ही अपनी ही मदद के लिए काम कर सकते हैं। सो मैं जो इस पॉलिसी में ऐड करना चाहूंगी या मैं गवर्नमेंट से करवाना चाहूंगी वो ये है कि शहरों में तो चलो फिर भी इसकी जो है वो अवेयरनेस हो रही है, हॉस्पिटल्स भी इसके ऊपर हिमसेल्फ काम करें, केई ने जैसे इनिशिएटिव लिया हुआ है, यूएचएस ने बहुत अच्छे इनिशिएटिव्स लिए हुए हैं, बट जो है रूरल एरियाज वाली साइड जो है वो भी बहुत ज्यादा निगलेक्टेड है गवर्नमेंट वाली साइड से। चाहे वो एक कमरे का अस्पताल हो, या वो कोई वहाँ पे कंपाउंडर हो, डॉक्टर हो, या वो टेलीमेडिसिन हो, वो उसकी जो है वो बहुत ज्यादा जरूरत है। सो मैं तो एंड पे यही कहना चाहूंगी कि हमें इसको ब्रॉडर स्कोप के अंदर देखना चाहिए, क्रॉस सेक्टर कोलैबोरेशन के तौर पर।
Thank you so much, Amna. Thank you. My last question is to Dr. Sara. And Dr. Sara, please elaborate if your partnerships with government were able to contribute to your company's financial sustainability or not. Over to you, Sara.
Okay, एक तो when the teacher talks, तो उसके आगे I don't want to add a lot because Dr. Shahzad is my teacher, and I think the things that he's mentioned in those 5 minutes are extremely crucial. That cross-sector collaboration can only work when people who are in power extend arms of collaboration towards private parties, which have in that relationship they are at the receiving end most of the time, or less in control or less in power. So thank you, Dr. Shahzad, for pointing that out. I think that was extremely crucial to point out. Or ustadi kar sakta hai sirf. I think value creation या sustainability को I see in 2 ways. I see in terms of financial and non-financial benefit that we got as a company out of COVID-19 working with the government. जो non-financial value creation है, उसको हम अक्सर उसकी बात नहीं करते, उसको mention नहीं करते. But I just want to mention that we were able to train almost 6,000 to 7,000 doctors on critical care, COVID-19, बेसिक प्राइमरी हेल्थ केयर, कम्युनिकेशन, टेलीमेडिसिन. हम सिस्टम में लेकर आए बहुत सारे डॉक्टर्स को, इवन मरहम डिड दैट, कि हमने उनको टेलीमेडिसिन पे गाइड किया. दैट इज अ वैल्यू क्रिएशन दैट दीज डॉक्टर्स विल हैव फॉर लाइफ. देन टेक्नोलॉजी अपग्रेडेशंस, डिजिटल टेक्नोलॉजी एक्सेलरेशन इन पाकिस्तान जो 10 साल में होनी थी, आई एम वेरी कॉन्फिडेंट टू से कि वो 10 महीने में हुई. वो इसी वजह से कि जब डिजास्टर आया तो एवरीवन टुक अपॉन दिस अपॉर्चुनिटी एंड वर्क टुवर्ड्स इट एज वन सिंगल यूनिट, बिकॉज वी, और सबका एक ही गोल था दैट वी हैव टू रिड्यूस द इफेक्ट ऑफ पेंडेमिक इन आवर कंट्री, बिकॉज आवर कंट्री इज ऑलरेडी फेसिंग हेल्थ चैलेंजेस, तो वो और हेल्थ चैलेंज फेस नहीं कर सकती. तो जो टेक्नोलॉजी में गेन हमें हुआ, जो टेली आईसीयू प्लेटफॉर्म हमने बनाया, टेली मेडिसिन के अंदर जो कस्टमर जर्नी इनहांस हुई, आज जो हमारा सोल्यूशन है वो हमारे 2019 20 के सोल्यूशन से बहुत ज्यादा बेहतर है. So this is a value add that we got. Third, I think the good part or the positive aspect of most of our projects was that we had a partner like UNDP, UNFPA, Australian Aid, who piloted these initiatives with us. So we had funding support. I think moving forward, there are two things that can happen or can be a possible solution. The current government is in place, the current health department, and Dr. Shahzad can add so much to this because most of the time he's the propeller from the government who's pushing for all of us. कि जितने भी initiatives जिन लोगों ने भी किए थे from the private sector, if the government can create a working group of these initiatives or the people who represented these initiatives और उनके साथ discuss करें कि अब going forward how can we create long-term initiatives based on these pilots, I think that is something which can be a good possibility. गवर्नमेंट का काम होता है कि वो प्रोजेक्ट्स क्रिएट करे, उनको टेंडर करे और फिर ओपन बिडिंग हो जिसके अंदर जो पार्टिसिपेट करे उसको वो प्रोजेक्ट मिले. फॉर एग्जांपल टेली आईसीयू प्रोजेक्ट है. टेली आईसीयू स्टिल अ नीड फॉर मेजॉरिटी ऑफ गवर्नमेंट आईसीयूज इन पाकिस्तान, and if an open tender is created for the tele ICU project, I'm sure a lot of good companies would compete and show productive growth towards that. Secondly, I think one thing that can be done is कि जो private organizations हैं, private hospitals हैं, जहाँ पर initiatives test किए गए, they need to be propelled and educated to create funding for digital healthcare interventions in their budgets. And they have the budgets. I think वो guidance या वो education नहीं होती या वो समझते हैं एक added expense है. But if we can just educate the private sector that budgets can be created for such initiatives and it's ultimately going to help them in the long run. And if we can talk to the government as a working group that which interventions were successful and how they can be created as how further expansion can be created as a part of government budgets, I think that can be a good initiative going forward. I'll tell you a very small example. We work with 4 insurance companies today who created a budget for telemedicine interventions ताकि उनके tertiary care claims कम हो उनकी organizations के लिए. They work with us as an OPD partner so that if a person is treated in primary healthcare, they would not go into tertiary healthcare and not have claims. So they took upon their interest to add telemedicine into their insurance product. So these are examples which can be replicated for many public health initiatives. And I think I just want to second one thing that Dr. Shahzad said, that primary healthcare in itself is a huge, huge market in Pakistan. There are so many elements for which अगर हम 4-5 telemedicine companies भी जमा हो जाएं तो हम सब मिलके भी कम पड़ेंगे. So there is an opportunity for all players to work together as a working group with the government to solve these initiatives, solve these problems. Thank you.
Thank you, Dr. Sara. Thank you for your input. I will now open, and now ask the participant to ask questions if they have any. So the floor is open to ask questions.
Thank you, Shamila, and thank you to all the participants. This was a very insightful discussion. I wanted to ask both Marham and Sehat Kahani. Both of them were able to gain a lot of customers during the pandemic, and they both offered free consultations for a while. Were they able to retain that customer base even after the initial pandemic scare faded off? Did those customers turn into paying repeated customers for either of them?
थैंक यू फरीहा फॉर आस्किंग दिस क्वेश्चन. ये बहुत अच्छा सवाल है और ये अक्सर प्लेटफॉर्म्स पे हमसे पूछा भी जाता है. अच्छा, यस वी वर, बल्कि जो है वो 300 टाइम्स जो है वो नंबर इंक्रीज हुआ है. लेकिन ये बहुत सरप्राइजिंग सी बात है बिकॉज इसका रीजन इस तरीके से है कि लोगों ने आइडेंटिफाई कर लिया या लोगों ने जान लिया कि उनका जो है वो टाइम या उनका कॉस्ट जो है वो टेलीमेडिसिन सेव कर सकती है. उस कोविड ने जो है वो ये एटीट्यूड बिल्ड करने में हेल्प किया है कि टेलीमेडिसिन जो है वो आपको किस तरीके से सपोर्ट कर सकती है इन टर्म्स ऑफ योर हेल्थ केयर. सो अगर मैं बात करूं कि कोविड के टाइम में हमारी 1000 कंसल्टेशंस होती थी तो अब जो है वो 3000 होती है. सो ये नंबर जो है वो कॉन्टिन्यूसली ग्रो कर रहा है. इसमें एक जो कॉन्ट्रीब्यूटरी फैक्टर ये भी है कि डॉक्टर्स जो हैं उन्होंने भी बहुत ज़्यादा स्टेप अप करना शुरू कर दिया है फॉर द टेलीमेडिसिन. बहुत सारे हॉस्पिटल्स भी इसमें इनकॉर्पोरेट हो रहे हैं और सपोर्ट कर रहे हैं कि आप टेलीमेडिसिन की तरफ आएँ. बिकॉज पेंडेमिक तो बेशक कम हो गया या कोविड चला भी गया अगर हम कहें, बट बहुत सारे और फैक्टर्स आ गए हैं जैसे कि अभी पॉलिटिकल कंडीशन है या इन्फ्लेशन है, जिस तरह लोगों की लाइफ्स जो है वो इफेक्ट हुई हैं. तो बहुत सारी चीजों में हमें टेलीमेडिसिन हेल्प करता है. सो और नंबर्स शो के बहुत ज्यादा जो है वो एक तो हमने रिटेन नहीं किया बल्कि टेलीमेडिसिन को जो है वो बहुत ज्यादा ग्रो भी किया है.
Over to you, Sara.
I think I briefly mentioned before, Fariha, ke after COVID has ended, last month we had the highest number of consultations on our platform. And that shows that people have adapted to the technology. I think it's just, इसमें बहुत बड़ा onus of responsibility है कि जब platform पे एक बंदा आता है तो उसका experience कैसा होता है. Are they getting the right kind of doctor? Is the doctor giving them time? Are they professional? Is the patient's issue being solved? So हमारे platform पे when a patient comes once, 40% of the time they come for a second consultation, 9% of the time they come for a third consultation. So definitely the ability of a customer to use a telemedicine platform is increasing. हाँ, जो challenge है, and I think वो बहुत सारी telemedicine companies face करती हैं, वो payability का challenge है. बहुत सारे लोगों के पास पाकिस्तान में अभी भी डिजिटल पेमेंट मैकेनिज्म्स नहीं है, और एक मेजर तबका पाकिस्तान का जो बुनियादी हेल्थ की सहूलतें से महरूम है वो औरतें हैं. और बहुत सारी औरतों के पास पाकिस्तान में स्मार्टफोन्स नहीं है, मोबाइल फोन्स नहीं है, उनके पास अकाउंट्स नहीं होते कि वो पे कर सकें अपने लिए. दे स्टिल डिपेंडेंट ऑन देयर हस्बैंड और देयर मेल पर्सन इन द फैमिली फॉर दैट. सो आई थिंक फॉर एन इंडिविजुअल कंज्यूमर बहुत जरूरी है कि डिजिटल पेमेंट मैकेनिज्म्स इंक्रीज हो. एंड एज न्यू फिनटेक्स आर कमिंग इनटू मार्केट, न्यू एबिलिटीज टू पे कमिंग इनटू मार्केट, रास मार्केट में आ गया है जो स्टेट बैंक का इनिशिएटिव है, आई थिंक इट विल ग्रो. और एज अ कंपनी हम भी इनोवेटिव सॉल्यूशंस ढूंढते हैं कि सब्सक्रिप्शन प्लान्स के जरिए या B2B मॉडल्स के जरिए, B2B2C मॉडल्स के जरिए पेमेंट का इशू सॉल्व कर सकें. बट जहां तक ट्रस्ट एंड डिपेंडेबिलिटी ऑन द प्लेटफॉर्म है, आई थिंक दैट इज पॉजिटिवली इंक्रीजिंग. And as I said, and Dr. Shahzad rightly said, the future of healthcare in Pakistan has to get digital, because at the end of the day, आपके पास कम डॉक्टर्स हैं और ज्यादा पेशेंट्स हैं, तो आपको टेक्नोलॉजी के जरिए उनको कनेक्ट करना पड़ेगा, चाहे आप BHU में करें, आप हेल्पलाइन से करें, आप कॉर्पोरेट्स में करें, आप कंज्यूमर्स में करें, आप क्लिनिक्स में करें. बट you have to consider technology as one of the enablers, वरना ये प्रॉब्लम आप सॉल्व नहीं कर सकेंगे for the long run.
Thank you, Sara. So there is one question from the participant, and he's addressing Amir Saab, and he's asking, okay, what kind of attributes do you look for in a startup when you're seeking for an innovative solution to partner with?
As I said, I mean, if you look at Sehat Kahani, that was an existing partnership. But the spirit of the question is that how does UNDP formulate partnerships? I think we have various partnership modalities. One partnership modality is that if we have an ongoing arrangement or a long-term agreement with a partner, then we can, go back to them for some more assistance whenever it is required. So that is one modality. We call it LTA, the long-term agreement. Sometimes the long-term agreement is based on one activity which we are doing, and we seek expression of interest for that, and then we expand it, if required later on. The other modality is a contract for a certain service, and for that we follow a competitive procurement process where it is advertised, and then organizations or people apply to that, and then there's evaluation of the bids and everything, and then a contract is awarded. So, but that is for specific services. From time to time, we follow a competitive process. So I would say there are no fixed attributes we are looking for, apart from some, let's say, requirements, which could be that the partners should have, a registration, some, history of having audits, so things like that. But it varies from a partner to partner. So I think if you are interested in that kind of partnership, please keep watching the space where UNDP is advertising for looking for various services, and that is where I think it's most relevant.
Can I add something?
Yes, sure, please.
Okay, so the issue is when you talk about the future of this health collaboration and other things, I am very much skeptical of this development of what you call it as health policies. Whenever there is a making of health policy, you think you have covered everything, but in fact you have not covered anything. It covers only hospitals, it covers only health workers. What about other very important aspects which are not covered by a Department of Health or Health Policy? So अगर आप मुझे कोई health policy का document देंगे और उसमें safe water की provision का कुछ नहीं होगा, food and nutrition का कुछ नहीं होगा, उसमें transport का नहीं होगा, access का नहीं होगा, क्वालिटी का नहीं होगा, फार्मास्यूटिकल का जिक्र नहीं होगा, तो मैं उस पॉलिसी को मैंने क्या करना है। इसी तरह एजुकेशन का नहीं होगा, हेल्थ एजुकेशन का या फैमिली प्लानिंग का पॉपुलेशन वेलफेयर वेलनेस मिनिस्ट्री है। तो अगर हम इस तरह से हेल्थ पॉलिसी के गिर्द घूमते रहे और हेल्थ पॉलिसी में सिर्फ हेल्थ डिपार्टमेंट को रख के हम पॉलिसियां बनाते रहे, तो हमारा हाल जो अगले 70 साल में भी ऐसा ही रहेगा जैसा 70 साल पीछे हुआ है। We have to get out of this concept of health policy. We have to get into something which is known as health in all policies. So what is health in all policies? Health in all policies का मतलब है वाटर एंड सैनिटेशन वाला जो पॉलिसी बनाए उसमें वो मेक श्योर करें कि उनकी पॉलिसी पाकिस्तान के लोगों की हेल्थ कैसे प्रमोट करती है। पॉपुलेशन वाले भी ये करें, आईटी वाले भी ये करें। तो डिजिटल टेक्नोलॉजी की जब कोई पॉलिसी बने तो बताएं कि ये हेल्थ वालों को कैसे सपोर्ट करती है, एजुकेशन को कैसे सपोर्ट करती है, हेल्थ को। सो ऑल द सेक्टर्स जो आप बात करें ना, मेरा ख्याल है ये क्रक्स है कि ऑल द सेक्टर्स ऑफ पाकिस्तान मस्ट बी मेड रिस्पॉन्सिबल ऑफ देयर शेयर, देयर रिस्पॉन्सिबिलिटी टुवर्ड्स हेल्थ ऑफ द पीपल ऑफ पाकिस्तान। डेफिनेशन ऑफ हेल्थ है फिजिकल वेलबीइंग, मेंटल वेलबीइंग एंड सोशल वेलबीइंग। एक चीज जो मैं बता रहा था कि क्यों हेल्थ वाले कॉन्शियस रहते हैं या क्यों हेल्थ वाले जो है वो सही तरीके से कोलैबोरेट नहीं करते, क्योंकि उन्होंने डेफिनेशन पढ़ी हुई है एब्सेंस ऑफ डिजीज और इन्फर्मिटी इज हेल्थ। जब आप एब्सेंस ऑफ डिजीज और इन्फर्मिटी पे जाएंगे तो आपकी हेल्थ पॉलिसी डिजीज खत्म करने पे लगी रहेगी, मलेरिया कंट्रोल पे, पोलियो कंट्रोल पे, हेपेटाइटिस कंट्रोल पे, एचआईवी कंट्रोल पे लगी रहेगी। डिजीज बर्डन के ऊपर ट्रीटमेंट फोकस रहेगा। आपने हेल्थ की बात ही नहीं की। We are not talking about economic well-being. We are talking about social well-being, physical well-being and mental well-being. जब हम ये चीजें करेंगे तो इनके लिए तो आपको बहुत सारे को इन्वॉल्व करना पड़ेगा। अपने ट्रीटमेंट फोकस के लिए तो आप बना सकते हैं, उसके लिए कमीशन बना दी है आपने, हेल्थ केयर कमीशन क्वालिटी ऑफ केयर के लिए। उसके लिए पॉलिसी बनाने की क्या जरूरत है? आप पब्लिक पार्टनरशिप की पॉलिसी बनाएं, आप डिजिटल हेल्थ की पॉलिसी बनाएं, हेल्थ में ऑटोमेशन की पॉलिसी बनाएं। अगर आपने हेल्थ पॉलिसी बनानी है तो आप हर सेक्टर को ये कहें, एक हमें पैराग्राफ लिख के दें कि आपका सेक्टर पाकिस्तान में हेल्थ प्रमोट करने के लिए क्या कर रहा है। आई थिंक दैट because then every sector will start. अभी तो वो टैक्स बचाने के लिए CSR में जाते हैं ना। कॉर्पोरेट सोशल रिस्पॉन्सिबिलिटी मैं क्यों करता हूँ? मैंने क्यों बड़ी बड़ी फिलैंथ्रोपीज में चैरिटी की? क्योंकि मैं चाहता हूँ मेरा नाम भी आए और मेरे जो है टैक्स सेविंग हो। मुझे मेरा ये इंसान की हेल्थ बेहतर करनी है, दुनिया की हेल्थ बेहतर करनी है। सो अगर हम हेल्दी पब्लिक पॉलिसी हैं तो बहुत सारी चीजें देगी। आई एम नॉट in favor of just a stand-alone health. और हमारा जो मॉडल है
Dr. Shahzad, we are losing your voice. I think there is a signal issue at your end. But yeah, yes, your input is very insightful. We are having problem hearing you. But you know that what you mentioned is that health, it should be like health in all policies. That's very, very important, very interesting you know, concept that you have actually shared with us. Thank you so much for your input. I'm just there is one more question from Anna.
Yes. Thank you, Shamila. I'd like to ask the next question. So Dr. Goraya briefly mentioned that the criteria that UNDP keeps in consideration when approaching a startup. I'd like to ask the same question from the government officials who are here in the conversation, that what do they look for when going for a partnership or going for a collaboration with a startup like Sehat Kahani? Is it the outreach or is it some other deciding factor that they look for? If somebody from the panelists could elaborate. Thank you.
Shamila, I have to leave for another meeting at 12. If I could say something very quickly and leave. I think I mean, inspired by Dr. Shahzad, he like health in everything. I think this is very, very important. And I'm just going to give you an example. We had, you know, health and education as two services which were not really, you know, up to the mark in Pakistan, and there have been various things around it. There have been talk about making, you know, education an elections issue, like, you know, corruption was an elections issue. So I think something drastic also, and there have been some donor-funded projects in the past where, let's say, which have been working very directly with the politicians for making education an issue, an elections issue, and, you know, rallying support, and not just, and sometimes, you know, highlighting those things, you have to come from, a slightly negative side and then, get the attention of the authorities. And sometimes it works. And you can see that some success which was achieved in terms of budget enhancement in education from 1-2% to about 4%. So I think this is very, very important what Dr. Shahzad has mentioned, that unless and until you bring out these basic issues as cross-cutting issues in everything else, it is going to be very, very difficult. You cannot have the most, because you see, we are one of the most populous countries in the world, and it's not going to change anytime soon. So things like health and education are actually cross-cutting across everything which we do, number one, and also across every service we provide, whether it is a water supply or it is a road link or something like that. So basically, I think completely agree on this, and just wanted to give my 2 pennies, and I apologize because I have to leave for another meeting with the CMU people. So thank you so much, Shamila, Dr. Shahzad, Sara,
Thank you.
and
Thank you.
Amna, other colleagues, Saflain, and
Thank you, Amir.
other colleagues. Great to see you today, and hope to be in touch. Thank you so much, and bye-bye.
Thank you so much, Dr. Amir.
Thank you, Amir.
Thank you so much. Anam had asked a question about the criteria that government has in shortlisting or collaborating with the startup. Actually, the time is running out, so I just wanted if Saflain, you can enlighten us briefly on this question.
Okay, I'll be very, very short about it. I mean, essentially, Amir has basically mentioned about the criteria which kind of like is prevalent in the development sector. When you talk about the government sector, the criteria is even more stringent. So, I mean, essentially, there are these PEPRA rules which got to be followed. When you talk about those PEPRA rules, and I mean, any partner who kind of like qualifies to basically do business with the government will have to basically fulfill the tendering process, which normally government kind of like issues for all of those for the engagement purposes. So I think that's it from my side.
Dr. Shahzad, do you have any input in it? Like, do you do it somehow differently, or do you follow the same rules as Saflain has mentioned when you are shortlisting a startup to collaborate with? Unfortunately, I think there are signals issues your end. Dr. Shahzad, there are signal issues at your end, but I'll write this question. Dr. Shahzad, there are some signal issues at your end, but I'll write that question in email so that I can then, share the reply with the participant and the panelist in the group. Yeah, I think we. But I would really, I'm really thankful to all the panelists and the participants.
Okay, I'll do that.
So I would now like to conclude the panel session.
Okay, I'll do that.
I thank you all for being part of this session, and I really hope that this session was helpful and provided you with the key insights on the value of cross-sector collaboration for each stakeholder, particularly during the public health crisis and for other public health issues in Pakistan. Thank you so much for your time. I'm really grateful once again, and I hope that we continue to make Pakistan a place where public health issues are tackled timely, and there are a lot of preventive ways that these public health crises do not occur in Pakistan. So if any of you have some concluding comment, please, you're welcome. Otherwise, it's basically the session is concluded. Thank you so much.
Thank you, Shamila. Thank you. I think you moderated excellent. And thank you to Impact Network for having such a great session for us. Thank you.
Thank you very much, Shamila. Thank you very much. It's been so nice. It was an honor to basically be here. And then more importantly, I would rather request you to basically keep on arranging such sessions, because these talks are obviously something which would possibly take us to the destination where we want to be. So thank you very much, Shamila.
Thank you, Saflain.
Thank you.
Thank you.